Hi fellows, in this video I will tell you about how to write lower limb arterial Doppler report. Let we select right lower limb arteriovenous study type. It has both arterial and venous components. In this video we will discuss only arterial component. In this arterial part of the report, on the right upper corner there is checkbox. By checking this checkbox, this arterial part of the report will be printed on final report. If you don't want to show this part in report, uncheck this box. All of these boxes in the upper part of the page indicate peak systolic velocities of the respective vessels. You may put peak systolic velocity values of all of these arteries, or may not put any of them. Whichever velocity you put in the box will be shown in printed report. If the report is normal, simply proceed to print. If there is diffuse atherosclerosis, click on this button. Usually, in this case, there is progressive loss of peak systolic velocities. You have to place values of proximal segment velocity and distal segment velocity. Like proximally, in common femoral artery, it is 120 centimeters per second, and the wave pattern is biphasic flow pattern, while distally, in posterior tibial artery, velocity is 30 centimeters per second and has monophasic flow pattern. Lastly, it asks about collateral flow, if present. Both report and impression are generated automatically. Multifocal stenosis button also functions similarly. Focal stenosis, as the name implies, is small lesion, so measurements are taken in close proximity of the stenosis. Clicking on this button opens up a window asking about vessel location proximal to the stenosis. For example, focal stenosis is located in superficial femoral artery. Clicking on the button for proximal superficial femoral artery opens up the window asking about velocity in the proximal segment. Let we put in the value of 90 centimeters per second and the wave pattern as triphasic. Then we select segment distal to the stenosis, like distal superficial femoral artery. By placing value of 320 centimeters per second and selecting monophasic waveform, it calculates the present stenosis by difference of peak systolic velocities as described by Kosman et al. Here the outcome is peak systolic velocity ratio is between 2 to 4, suggestive of 50 to 75% luminal stenosis. This last button is for locations of complete obstruction of artery by thrombus. Clicking it opens a window asking about selecting the arteries showing thrombus. Select number of the vessels as required and press OK. This will generate report describing the thrombus in described arteries.